Today we will be discussing the anatomy of the hip joint. So, the competency which is related to the hip joint given in the UG curriculum is, at the end of the session, you will be able to describe and demonstrate the type, articular surface, capsule, synovial membrane, ligaments, relations, movements, muscles involved, blood supply, nerve supply and bursa around the joint. This is a bigger competency. We will be discussing only the articulating surfaces and ligaments of the hip joint in this session. The other competencies which are related to the hip joint, they are the AN 17.2 and AN 17.3 related to the clinical anatomy of the hip joint, the anatomical basis for the complications for the fracture neck of femur and the dislocation of hip joint at surgical hip replacement. So just be oriented in the whole session so that the further competencies which are related to the session, you will be able to understand them better. So hip joint, it is a joint, that means it is formed by articulation between the two bones. So it is a synovial kind of joint. You know there are three varieties of joints, the fibrous, cartilaginous and the synovial type. So hip joint is a synovial kind of joint. It has got a synovial cavity. Then it is a ball and socket variety of hip joint. If I am saying ball and socket, that means the articulating surfaces which are forming this joint. So one surface should be of the shape of a ball and the other surface should be of the shape of a socket. So this is the pelvis. You know these are the lumbar vertebra, this is the sacrum and these are the two hip bones. You can make out over here, femur is articulating, the head of the femur is articulating with the acetabulum or the lunate surface, I will say, it will be better, it will be articulating with the lunate surface of the acetabulum to form the hip joint. Now just have a look at the acetabulum. This is the acetabular fossa present in the center and this is the lunate surface with which the head of the femur articulates, and then a synovial type of joint is formed which is covered by a synovial membrane, and of course it is going to have the ligaments. So now this is the picture, or we can say a posterior view of the hip joint. If we look at the hip bone from behind, this is the acetabulum, this is the head of the femur, neck, and then these are the two trochanters, the greater trochanter and the lesser trochanter. So this is the posterior view of the hip joint. Again, the articulating surfaces are shown. The head of the femur here is covered by the hyaline cartilage. Again, you can see the lunate surface is also covered by the hyaline cartilage. Then in the center, the acetabular fossa will be covered with a pad of fat. And you can make out the ligament of head of femur which is attached to a pit present in the center of the head of femur. Now this shape of the head is of a sphere and it forms the 2/3 of sphere, and then the articulation. So till now we have discussed that in the hip joint the articulation occurs between the head of the femur which forms the ball and the acetabulum which forms the socket for the hip joint. Now this acetabulum has got an articular surface which we have discussed. It is lunate shape, it has got a semilunar shape. Then a non-articular surface, the acetabular fossa present in the center. Now this acetabulum is deficient inferiorly and we call that portion as acetabular notch. And the acetabular labrum is attached to the margins of the lunate surface and it deepens the articulating surface. So it is a fibrocartilage. Now two kinds of cartilages are present in the hip joint, the hyaline cartilage as well as the fibrocartilage. Now every joint, as you know, it is stabilized by certain ligaments. Because synovial joints are having a joint cavity, they are going to perform certain movements, but for the stability ligaments are required. So these are the ligaments which provide stability to the hip joint. Now if we compare shoulder joint and hip joint, because both these joints are of ball and socket variety, the hip joint is more stable and its ligaments are more stronger. Out of these, this iliofemoral ligament, it is the strongest ligament present in the body. And movements, if we say, the range of movement is more at the shoulder joint, and the range of movement is decreased or it is less in case of hip joint. So these are the ligaments: the fibrous capsule, which will be covering the joint, the iliofemoral ligament, pubofemoral ligament, ischiofemoral ligament. Now the names of these ligaments, you don't have to cram. Hip bone consists of three parts: ilium, ischium and pubis. And here the hip bone is attached to the femur. So the names of the ligaments are: from ilium to femur is iliofemoral, from pubis to ischium, from pubis to femur bone is pubofemoral, from ischium to femur is ischiofemoral ligament. Then there is a ligament which is attached to the acetabular notch. So that ligament is transversely placed in the body, so that is transverse acetabular ligament. Then there is a ligament of head of femur attached to a depression, which we have seen in the picture. Now this is the picture or image to show the fibrous capsule. You can make out this whole joint is covered by fibrous capsule. Now what are the places of attachments for this fibrous capsule? It lines it covers actually the whole of the joint cavity. So it is attached to the acetabular margin on one side, and then it goes to the neck of femur. So we will be seeing to where and where it is attached anteriorly and posteriorly to the femur. Onto the femur there are two trochanters, the greater trochanter and the lesser trochanter. Between the two trochanters there is intertrochanteric line anteriorly, and to this anterior trochanteric line the fibrous capsule is attached. And onto the other end, to the acetabular margin, it is attached. Posteriorly, the capsule is not attached to the intertrochanteric crest, but it is 1 centimeter width anterior to the intertrochanteric crest. Now this fibrous capsule, it encloses the joint. Its attachments are medially to the acetabular labrum, as we have discussed, and then to the transverse acetabular ligament. Laterally it is attached to the intertrochanteric line, as we have discussed, and then it is attached to the intertrochanteric crest posteriorly, but 1 centimeter anterior to the intertrochanteric crest. And then some fibers are reflected upwards from the neck of the femur, because these fibers are actually the retinacular fibers, and under these fibers the blood supply to the femur, it passes to the head of the femur, it passes. So retinacula, they carry the blood vessels which supply the head and neck of femur. So blood supply to the head of the femur is going from downwards to upwards. It is not coming from upwards to downwards. This point you have to keep in your mind, because this is actually the basis behind the avascular necrosis for the head of femur. Now this is the acetabulum, this is the head of femur, and then you can make out this is the joint cavity. So the fibrous capsule is lining the joint cavity, and this is the synovial membrane which is lining the joint cavity, and of course the joint surfaces, they are covered by the hyaline cartilage. So you can make out the hyaline cartilage, you can make out the fibrous capsule, you can make out the joint cavity over here, and then this is the structure of the hip joint. So Now coming to the other ligaments which provide stability to the hip joint. So till now we have discussed the fibrous capsule, the other ligaments which are responsible to provide stability to this joint, two ligaments, the ischiofemoral and pubofemoral, you can make out in the picture. This is ischiofemoral ligament and this is pubofemoral ligament. These two ligaments are present in the front and ischiofemoral ligament is present behind. I think the iliofemoral and pubofemoral ligaments, they are present in the front and ischiofemoral ligament is present behind. So iliofemoral ligament is the strongest ligament in the body. It is inverted Y shaped. You can make out the two limbs of the Y. It is coming from anterior inferior iliac spine and then it is going to the neck of the femur. So this is iliofemoral ligament. The second one is pubofemoral ligament coming from the pubic ramus and it is going then it merges with the fibrous capsule. One more thing which is visible over here is the bursa. This is the bursa present between the iliofemoral ligament and the pubofemoral ligament. You know, bursa reduce the friction between the two structures. So here a bursa is present and this is the iliopsoas bursa. Now coming to the iliofemoral ligament, what we have discussed, I will summarize. It is an inverted Y-shaped ligament. It is one of the strongest ligaments of the body and it lies on the front of the joint. Attachments we have discussed. Proximally it is attached to anterior inferior iliac spine. Distally it is attached to intertrochanteric line of the femur. Now if this ligament is present in the front, what do you think is its function? When femur moves anteriorly, that thing we call as flexion, and when femur moves posteriorly, we call that thing as extension. So it limits the extension as it is present in front. It will prevent overextension during standing. So flexion and extension. Now the pubofemoral ligament. It is a triangular ligament. Above it is attached to the pubic bone and obturator membrane and it passes inferiorly and laterally to merge with the fibrous capsule and it blends with the iliofemoral ligament. So pubofemoral ligament and iliofemoral ligament, they are present in the front and ischiofemoral ligament is present behind. It also limits extension and abduction at the hip joint. Now which movements are possible at the hip joints? At hip joint, it is a multi-axial kind of hip joint, multi-axial variety of the joint. It is a synovial joint, so we can do flexion, extension, medial rotation, lateral rotation, adduction and abduction. So all these movements are possible. Out of that, the pubofemoral ligament, it prevents the extension and abduction. The ischiofemoral ligament, it is a spiral shaped ligament which arises from the body of the ischium below the acetabulum and it runs upwards and laterally into the fibrous capsule. It also limits the extension. So there is one more ligament, the ligament present on the head of femur. It is flat and triangular. It is a triangular shaped ligament whose apex is attached to the head of the femur and then its base is up to the transverse acetabular ligament. Its function is to transmit blood vessels to the head of the femur. So it transmits blood vessels also. Now look at this picture. This is head of femur. This is acetabulum. This is the lunate part. In the center, acetabular fossa is present. Now this ligament is the ligament of head of femur and we can make out in the picture a vessel that is a branch of the obturator artery which will travel along this ligament to reach to the head of femur. So this ligament is triangular shaped and a vessel also passes along this ligament. Now acetabular labrum, as I told you in the beginning, there is a fibrocartilaginous rim which is attached to the margins of the acetabulum, and its function is to deepen the joint cavity. So it is a fibrocartilaginous kind of labrum and it is attached to the rim of the acetabulum. It deepens the acetabular cavity to retain the head of the femur within the acetabulum. And then the synovial membrane. Now we have discussed all the ligaments which we have planned for this session. We have discussed the articulating surfaces. Now it is the synovial membrane. It lines the internal surface of the capsule and neck of the capsule, and a pouch of this membrane also protrudes outwards. So this is about the synovial membrane. So till now we have completed all the objectives of the session. I hope you understood well. So thanks a lot. Thank you.